The CT-7 femoral traction splint is supplied ready for use and includes an additional leg strap for patients with longer legs. Begin by unpacking the ankle and groin straps. The ankle strap is directional, with the buckle facing toward the foot. Wrap it securely around the ankle and fasten it using the Velcro. Keep the buckle firmly positioned, pointing down the leg. Next, slide the groin strap buckle gently under the thigh, guiding it carefully into the groin area while avoiding any movement of the fracture. Attach the buckle ends and tighten. This leaves two cylindrical holders on the outer thigh, designed to receive the splint poles. Assemble the pole and position it alongside the injured leg. Fully screw in the tensioning device, which allows you to set the correct length. Secure the distal end with the ankle buckle, then measure the splint against the leg. Adjust the length by disassembling or reassembling the pole parts until the fit is correct. Slip both ends into the pole holders, making sure not to force the poles into place. Final adjustments can be made at the opposite end. Apply Velcro straps above and below the knee, being careful to avoid the fracture site. For very long legs, use the additional Velcro strap provided. Always remember that movement may cause significant pain, so provide adequate analgesia before traction is applied. To apply traction, turn the tensioning device in the direction of the arrows. Initially, there may be little resistance, but as traction takes effect, you'll feel it engage. The correct endpoint is when both feet are aligned, obvious deformity is reduced, pain improves, and bleeding may decrease. Finally, inspect the splint to ensure it is secure and check distal pulses. If pulses are absent, escalate care immediately.